from the start. Sorry, I just got the notification of the recording.
So I was like, oh, I should probably, just in case
Yeah.
lab screws me again. So
So I went to physical therapy school specifically to specialize in women's health. It was my interest, is kind of my passion, something that's not talked about a lot, and the information's not out there. It's getting a little more well known, but not a ton. So yeah, I got my undergraduate degree from Iowa State, went to Des Moines University. They have a pretty strong women's health program, which is exciting. And within women's health, even you can kind of specialize in different areas. So you'll hear that thrown around a lot. They've actually kind of switched from women's health a lot more to pelvic physical therapy because they treat
okay,
not
I was
only
gonna
women,
say,
but men.
yeah. So like,
Yeah.
just women's, or I've heard, I hate to call it a buzzword, because buzzword to me like kind of is like trendy, and this is not trendy. This is definitely something that like needs to be something, but I keep hearing pelvic floor therapy, and I'm like, I just have so many questions. And then whenever it dawned on me, like, why, like, she's the perfect resource for this, like, I should be talking to her. So that's awesome. I'm sorry, I didn't mean to interrupt. Go ahead.
No, you're good. I still prefer the term women's health physical therapy just because that's where my interest lies. However, there are a lot of physical therapists out there who do treat both men and women. And so I kind of understand why they switched to the pelvic area. However, women's health PT does go beyond the pelvis. My mom had breast cancer. She ended up getting a mastectomy, and afterwards had some frozen shoulder and other things. And so that was kind of my first exposure to women's health PT. And then I got to learn about everything else. And obviously, like, your breast is not your pelvis. So like, that's why I prefer the women's health term. But yeah, it's everything from incontinence, whether, you pee your pants when you laugh, or if you jump, like little things, or if it's like, you can't control your bladder or your bowel. It can be constipation. It can be pain, even pain in your back. A lot of times people are like, oh, my lower back hurts so much. Like, it may not be a back problem. It could be a pelvis problem. Swelling, pregnancy and postpartum, I think, is finally starting to get a lot more recognition, but people only like think, oh, well, if I have pain or if I'm peeing, then I should get a consult, where
That's like,
really you want to get ahead of it.
that was like my number one question, because I mean, I haven't had children. So I am like, I'm sitting in front of this window just watching this snowstorm. I assume this is a snowstorm. I don't know. For anybody watching. So I'm in Des Moines, Iowa right now, which is why Brittany couldn't be right next to me, because we have this snowstorm going on outside. But I'm just enamored by like it's just so cool. But also I'm glad I'm not out there. Anyway, so I've never had children, but I hear like some of the issues that you're saying, and I'm like, well, maybe I need to see a women's health physical therapist, because like, how do you know, like, how do you know when you should see one? Like, you talked about prevention and like catching it before it becomes a problem and stuff, but like, how do you know when it's time to see a women's health physical therapist?
My personal opinion on that is, if you are a woman or a woman, see a women's health physical therapist. Like, honestly, I think anybody can benefit from it. Now, that also kind of depends where you are at in life, and it is a bit of a financial obligation. However, while it's like a specific type of physical therapy, it's covered under your normal insurance. Everybody has direct access. It's just a matter of what direct access means in your specific state. It can be a little different. So if anybody has questions about nuances on that, you can contact me. There's a lot of out-of-pocket physical therapists also that don't necessarily take insurance, but even though you're paying out of pocket, you can get reimbursed by insurance.
Gotcha. Okay. Yeah, because I wondered, like, do you need like a referral and things like that? And if so, would it be like I would go to my PCP and be like, hey, I want to see a physical therapist for this particular issue? Or so I can literally just like ring up my local physical therapist and be like, hey, what would I know you said something specific to like pelvic floor physical therapy, and so if I saw that as a doctor's specialty, would it be okay to assume that they would be privy to like, or they would be specializing in other women's situations? Like you mentioned like the frozen shoulder from the mastectomy, which I know we have a couple people in our VIP group who are about to be going on that journey. And so, that's something that would be very valuable to them. But how do they know, like when you're going on Google trying to find your little physical therapist, like what do I look for whenever I'm looking for someone who can help me specifically in women's health?
Yeah, I think you kind of have to figure out where you fall on the holistic scale as well. Because there are some women's health therapists that are very what I call woo woo. And I use that term with endearment because I was not woo woo until I went to grad school. And then it's like, okay, it seems woo woo, but like it works. So like if it works, I'm going to do it.
Yeah,
Sort
yeah,
of
yeah.
thing. But then there's also others who are more like sports oriented, that typical what you
Okay.
think of in our society as physical therapy. And there's different databases. I can kind of link those in the group afterwards, but there's different databases for the different kind of philosophies and the types of women's health physical therapy. But just Google whatever your issue is and then like type in your state and physical therapy. And
Okay,
that
cool.
should lead you. A lot of people write blogs. You can find them that
Yeah,
way
true.
to figure out. Yeah. And usually if they say pelvic, they'll also do other issues. If they are talking about something else, they'll also do pelvis, but you'll find different people kind of specialize in different areas and ultimately call them up and ask. I've had people call me when I was practicing and say, "Hey, my doctor told me I have this. Is that something you can work with?" And I would be upfront and honest because it's my name on the line also. Like
Yeah.
as much as I want to help you, like if I don't think I can help you, I'm going to refer you to somebody else.
Right. Well, that is all really valuable information. Today we are niching down on our topic and talking specifically about sexual health. And so give me a little bit of what are some concerns that I might have to reach out to someone like you for help as it pertains to sexual health. And I know we have a couple specific questions that we'll be going over, but just generally speaking, like what are some common things that people might be presented with that would encourage them or prompt them to call you?
Mhm. I love the fact that you use the word common. It's very big that I like to discuss the difference between common and normal. So, like, menstrual pain is common. Like, everybody talks about, oh, I have so much pain. Like, your period should not be painful. Like,
Dang, that's crazy. Like
yeah,
people are
you
gonna
should
see
not
this and
experience
be like,
pain. Yeah. Now, I will caveat that with the fact of there it's a balance. So just like um
I guess like the difference too in like pain and uncomfortable. Like, so what is,
yeah,
do you expect it, or is normal uncomfortable, or should it really not have any type of like physical effect on like
mm,
your day to day? Like, what do you mean? Like as far as like period pains and stuff?
you should be able to go about your day as normal when you're on your period. Now, part of what factors into that is like inflammation and things like that. So then that goes down to your diet. And so it's a balance of, you know, I love to eat a whole package of Girl Scout cookies, in one sitting, but I don't do it all the time. And so it's that give and take of where are you finding your joy in life also. And so like when I sit down with women, I ask them, like I'm here to provide you the facts and then it's up to you to do with it what you wish.
Yeah. Yeah.
Do you find more importance in eating a clean diet or having that pain? Because it
Right.
might be an either or situation, but I'd like to let them know that there's at least hope and there is an
Yeah.
option. And
Yeah.
then it's up
Yeah.
to you to make that choice.
Right. Yeah. I like that.
Yeah.
And that kind of like is right in on the journey that I've been taking with really everything. It's like I've tried to do my best to collect information, like whatever it is, whether it's about health or food or just like perspective and just the world, just collecting information and doing with it what I can and what I'm willing to do to,
Mhm.
to see that cause and effect. So I like that you specifically were like, okay, you said common, but
Yeah.
what is common isn't necessarily normal or should be expected. So
Yeah.
tell me, what are things sexual wise that may be common that is not normal that should prompt me to give a physical therapist a call?
So it should never be I say it should never be painful, but also recognizing that some people like that is their deal.
Yeah.
And so not that you like can't bring pain into it, pain and joy,
If it's
but
unexpected, not pleasurable pain,
yeah.
then maybe you should see a doctor.
Maybe you should see a doctor.
Yeah.
It should be enjoyable. And there's also a difference between like external pain, whether it just feels like you have a lot of friction, if you're having troubles with lubrication, things like that, which still women's health PT can help with. They will assess you. We can get into like what actually an appointment looks like later, but to figure out like, is it more that skin discomfort or is it like a deep inside discomfort? And then, like I've had to talk with women about different positions, whether that's just normal, I would say day-to-day sex, or if that is like when you're pregnant or after a surgery, if you are having issues in your shoulder or somewhere else, like you can't do the same positions, and physical therapy can help with that. Like we're very open. We have lots of conversations, but it should never be painful. Kegels are not the solution. And as I said in the comments, we'll have a whole discussion sometime about Kegels.
I put a pin in that one. I'm like, okay, she said it's like a whole conversation. We're gonna just have a conversation about that on another point. But I like that, because that's like if you go on Facebook and you're like, oh, I'm having this pain while I have sex, everybody is gonna be like, oh, you just need to do some pelvic exercises. Like, oh, that's the solution.
So the short version of that I'll explain is like, as women, we tend to be more anxious, and I am going to generalize here. Nothing I say is actual medical advice. It's all just, educational purposes. But if you were to try to strengthen your arm all the time and you were to hold it up like this, like your arm is not functional. Like walk around all day like this and then try to pick something up with your arm. Like you're going to have pain, not even necessarily pain here. You might have pain here. You can have pain over here because it's all pulling. So where you feel the pain is not necessarily where the issue is. And it may not be a strength issue. People are like, oh, I need to be tight. I need to be strong. Like all these things. Like, girl, you need to relax. And a lot of doctors will say like, oh, just have a glass of wine and that's what will make sex better. Like it might, but honestly, if you need alcohol for sex to not be painful, there's a deeper issue going on. Yeah. And it may be a women's health physical therapist because of muscles. It may be psychological that you need to bring in a mental health professional.
Right.
But they'll be able to, and usually like they work side to side because the brain and the body are so interconnected. But being able to fully function.
I'm like teetering on a box here.
So the pelvic floor should be able to do the same thing. It should be able to relax and it should be able to contract up. There's slow squeezes, there's fast squeezes. There was a study done that said, I think it was like only 10% of women who are given verbal explanations of a Kegel know how to do it correctly.
Yeah, that was like a big question. So like I've heard, like you're saying, verbal or like even in print, you go and you're like, okay, how to do a Kegel? Like, what do I do? And you think you're doing it, but also like, what if I'm not? Because I also have the same question about, this is like, I'm kind of like going off on whatever right now, but like, I read this thing and it said something like, when you sit down to pee, you should not have to like push. It should just kind of like, I don't know exactly what it said because I was like, oh, okay, whatever. But then I paid attention the next time I got on the toilet to pee and I was like, I don't know, am I pushing? I don't know. I can't tell. Like, am I? Is this considered pushing? I don't know. But it's like, we just don't know enough about our bodies because nobody knows except you people. And that's what it's just like, it for so long it's been such a taboo subject that people are just, they just either make it a shameful thing, or they're embarrassed to talk about it, or so we don't really know what is normal. We
Yeah.
know, we don't know what's normal because nobody's willing to talk about it. So,
Mhm.
yeah, so that was just another example of like when I sit on the toilet and pee, like am I really pushing? I don't feel like I am, but maybe I am, and I don't
Yeah.
know that. So,
Well, and every person's different. That's the other part of it. And saw a kind of cool thing the other day that said, like, especially women versus men. And that's why I also like to specialize in and like specify the women's health physical therapy part of it,
mhm,
because our bodies are made to work at a higher fat percentage than men.
right.
And that's the way it is, and that's how we're going to be healthier. And so you see these fitness models who have the flat stomachs, the six pack, and like all these things. But what you don't know is if they can't breathe correctly, breath work is huge in women's health PT. If they can't breathe correctly and they're holding those muscles tight all the time, like there's a good chance they have prolapse or they're having pain. They're not, enjoying
Yeah.
things. And, we're talking about sex, but a lot of it too is the intimacy aspect
Yeah.
of it. And if
So
you don't have that, your body isn't
it's
ready to
consider
have it.
yeah, yeah.
Yeah.
So it's interesting that you mentioned prolapse. So someone on the VIP group had mentioned a prolapse as well. And honestly, I didn't even know it was a thing until I worked with horses for so long. And like it just so happened that we had a horse that had a prolapse vagina. And that's like literally the only reason I know what it
Mm,
is. And I think it's like it would be so alarming to see that, like, to have that experience and not
mhm.
know, 1, what's going on, 2, what could happen, and 3, how to fix it? So tell me a little bit more, because other people may not know what it is. So give me like the quick and dirty of how do you know if you have a prolapsed vagina? What is a prolapse? And when would it be most like when is it most prevalent? I would assume probably after childbirth, but I don't know that for sure. And like is that something that you would help with as a physical therapist, or would that be like a different kind of branch?
Yeah. Prolapses, I think, are a lot more common than we know. I'll be fully transparent. I have a prolapse now. I didn't really have one before having a baby, and now I do. And that's, I think, when we talk about it. But
Mhm.
I have treated a lot of women who had prolapse who had not had a baby. So sometimes it's a result. Most of the time, it's due to just not having the correct knowledge of how to control the pressure in our abdomen. And so, like, when you lift something up, you should not hold your breath, and we're taught that for our back, but it's
Yeah.
also for our pelvis.
Yeah.
And
Yeah,
it's
that's
all
true.
connected. Um, and there's different types of prolapse. So you can have your bladder can actually prolapse. So say this is like your vaginal vault, and down here is your opening. You
Mhm.
can have a prolapse from the front, from the bladder. It can be the vagina that's in the middle that's prolapsing down, or it can actually be your colon, and the
Okay.
bowels that are coming down.
Okay. So it would be one of those two things. It's not like a in my head, what I feel like in my because like I always think like the vagina is like ginormously
Yeah.
long, like you think it's so far away. And so in my head, I'm like, oh, it must be like a piece of the vaginal wall or something that's
Mm,
like protruding. But again, like I don't know enough about anatomy to know like,
yes.
the knee, elbow, shoulder, head, whatever, like it really is all connected.
Mhm.
And so it really would be like either the bladder or the what did you say that
It can be your bladder, it can be the bowels, or it can be the
bowels?
vagina just coming
Okay, okay. So it
down,
could be like it
or
could
the
be the
uterus
vagina. Okay,
coming
okay.
through the
Okay.
yeah. And a lot of these terms, if you like look them up, they're not anatomically correct, and I'm trying to, like, keep it, very, like, general
Yeah,
terms
yeah.
that most people would know. Because if you, like, really look into it, the vagina is different than the uterus. It's
Right.
different than the labia, and, you have the majora, you have the minora, and you have the vestibule, and, like, there's
Yeah.
all these terms that I could just, like, start throwing out
Yeah,
there,
yeah.
but ultimately, it comes down to it's one of those 3.
Yeah.
Treatment-wise, from my aspect of it, is all pretty similar, and there's different grades. So like it could just barely be coming down. It can just be at the opening. It could be where it's like actually coming out of your opening. Most
It
people,
consistently out, or would it be like if you were I assume like if you were sitting on the toilet, there would be pressure, like downward
Mhm.
pressure that might make it like protrude, or like if you were lifting something, is that kind of, or are there some people who it's just always just protruding?
Yeah, there's some people that it always just kind of comes out. And usually like it'll come out, but they can push it back in.
Okay.
Or, like, and so that's a big reason why you want to make sure that your bowel and bladder health are very healthy, I guess. Like
Yeah.
you're staying on top of it. There's the Bristol stool chart out there that people can look up. I'll try to remember to tag that also. That shows you like what your poop should look like, because I don't think we talk about poop either,
No,
especially
we
as
don't.
women. We're like, "Oh, we don't poop, we don't
Yeah.
fart." Like, yes, we do. We queef. I know that that
Yeah.
was coming up.
Yes, that one is coming up. I have so many questions about that
Yeah,
one.
but like there's something you can do for the prolapse. But again, they tell you, oh, just strengthen your muscles, or oh, there's nothing you
Yeah.
can do about it. Oh, there's surgery. And then you hear about the mesh implants and like all the dangers of that. And I will say always seek physical therapy first before surgery. If
Yeah.
nothing else, it puts your muscles in a better position to support the mesh,
Yeah.
or whatever they do. There's also, why am I blanking on the word right now? Pessaries. There we go. I knew it was a P word. Pessaries that you can use. And there's like a billion different types. I'm not personally trained in fitting them. So there's very few women's health physical therapists that are, I would say. Um, but they should be able to find somebody to connect you with to
Mhm.
fit a pessary, which is just a plastic object that is inserted. Either you insert it or the doctor actually inserts it for you, and it stays up there for however long. That helps support that wall if you do have some weakening of
Okay.
the wall because it's been a long time.
Gotcha. So what are the like the first signs? Like I feel like if I had this experience, I wouldn't know until I saw it or
Mm,
felt it.
mhm.
So like are there any indications that might happen or might come before it becomes a prolapse that I can address, or is it really just like you're like, oh shit, like my insides are coming out. What do I do? I mean, that was
Yeah.
me.
I mean, I only know that I have one because my midwife told me.
Okay.
Like when she was doing the assessment, she was like, "Hey, like, you have a prolapse, just letting you know, like it's mild, blah, 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 blah."
Yeah.
Some people feel like they're sitting on a golf ball or they just have discomfort when they're wiping, things like that.
Yeah.
Um, but ask when you go in for your yearly appointment, to get like
Okay.
either, which pap smears aren't necessarily every year, but whenever you go, like I would really encourage to have those internal assessments, whether you're going to a women's health PT or if you're going to your normal gynecologist.
Okay.
And just ask them, be like, "Hey, do I have a prolapse?" And don't freak out about it if they tell you
It's
yes. Like it is
so
not
weird
the
that
end of the
they
world.
don't just tell you. Like, I feel like you
Yeah.
should tell me that, you know? Like,
Mhm.
I mean, you're already up there cruising. Like, tell me if I got something funky up there, or not that it's funky. It's totally,
Yeah,
it sounds
yeah.
like it's like common, but it's like, it's so strange to me that it's just not delivered. Like, I feel
Mhm.
like that would be something that you would deliver. Um, but yeah, okay. So all of that is great information. I'm about to so I wasn't expecting to be on Zoom today, and I have 10 minutes left of my free whatever. So I'm trying to upgrade at this moment. So if I seem distracted, I am, but I am listening. So the biggest question that I have, so I had weight
Mhm.
loss surgery,
Yep.
significant weight loss. I did a quick Google search and was like, why am I queefing so much
Yeah.
now? Is that, and I've asked a couple people who have also had significant weight loss, and I'm like, girl, like, is it more like, or is it happening more for you too? And they're all saying the same thing. They're like, yeah, like it's like so prevalent. So like, what is it that caused that? Or obviously it's coming from weight loss in some kind of way, but like what is it? What exactly is a queef?
Mhm.
And why does it become more prevalent after weight loss?
So a queef is just releasing of air from the vaginal opening. There's different reasons you can end up with air inside your vagina. And a lot of times it happens with intercourse. If you have something going in and out of you, it's pushing that air in,
Mhm.
and that air has to go somewhere,
Yeah.
and so it's coming out. Now, not everybody queefs, or not everybody knows that they do it. It can be like quiet. It might just happen when you're going to the bathroom, or it can happen during other times, like every person's different. Um, as for why it happens after extreme weight loss, this is purely just my conjecture and throwing it out there. But I did a little bit of looking online as well since you brought it up. And it's just because your body has changed so quickly. So it's trying to get used to the new arrangement. You don't have as much um, of the fat cells like pushing on the vagina. So it might have actually like, because everything inside is changing where it's at and how it's held, your vagina can actually be, or your uterus can actually be like folding in different ways. And there's a bunch of different, like your vaginas or your uterus, I'm going to use both, or it's not just this like nice opening, or
Yeah.
the vaginal canal, but like it has ripples along it. And so if you have something pushing, it's pushing it this way. We know how the uterus moves when we're pregnant and have kind of seen that. But
Mhm.
even when you're not pregnant, like it's constantly moving. You have things pushing on it. If you are constipated, you're having your bowels are pushing up against it. If
Right.
your
Okay.
bladder's full, it's pushing on it from the other direction.
Right.
Um, so everything we do, if you're exercising more, that can cause it to happen more, just because it might be a bunch of
Well, that's not
small
my
little air
issue.
bubbles.
Let's
Not
just
mine
clear
either,
that
it's
up. That's
okay.
not me.
Yeah, but it can, like, cause those air bubbles to combine together, and
Okay.
then it just makes a bigger air bubble, and then that's what comes out, so you might notice it more.
Okay. So it's kind of like so if I'm trying to think it. So in my case, because look, obviously I ain't the only one that noticed it, right? Like Evan's like, okay, which he's always so chivalrous and doesn't say anything and it's fine. And queefing is something that I've experienced plenty of times before, but it was like, I don't know, it had to have been as of like maybe 5 or 6 months
Mhm.
ago. I was just like, damn, like, is he just going in and out too much? Because you hear that's like the big thing, right? Like people were like,
Yeah.
oh, it's because his wiener is too small and it's just like he's pulling it in and out or whatever the whatever word I'm trying to think of is. But it's like that's not the case, right? So like
Mhm.
it's like, oh, well, try it this way and it still happens.
Yeah.
So it's like something else is going on. And it sounds like maybe like the vaginal wall is, would it ever be like thinner? Would
It
it ever thin?
could be thinner. I would say it's probably more that there's more room for it to move.
Okay.
So where before
Okay.
it could have pushed out the air before it became a bigger bubble that you noticed
Right.
it,
Okay.
now there's more space internally to
Okay.
push, so you're, like,
I
getting
see.
more and more air
Okay.
inside
Okay.
before it's pushed out.
So does that make my vagina feel larger or no? I mean, you don't know.
You
You haven't been
know?
up there, but
Yeah, I'm not sure. And I think that's a thing too, people, like, get really worried about how tight they are or how big they are inside. And excuse me, I know it's a lot of, like, people get really worried postpartum about it too.
Mhm.
And ultimately, like, that's not necessarily accurate. And so
Okay.
if your muscles are working more appropriately, I don't like to use the word strong and I don't like to use the word loose and things like that, but if they are working better, it's going to be more enjoyable, both for yourself, because even think about, like, if you are working out, the blood is going to that area.
Right.
And
Okay.
so if
Yeah.
you're
Okay.
getting the
That makes
blood to
sense.
that area, the nerves are regenerating better.
Right.
They're getting stronger. It's going to be more pleasurable because it's used to, like, we also explain it a little bit in pain management. But like, if I tell you not to think of a pink elephant, you're now thinking about a pink
Yeah,
elephant.
yeah,
So like if
yeah,
we ignore pelvic floor, we're probably not going to think about it. But once we start paying attention to it,
yeah,
we're going to become more aware. Now that can also sometimes be like suddenly you're like, oh man, I'm having all this pain or all these weird
yeah, yeah.
feelings. Like recognize it, but then like try to figure out the why and then
Right.
approach it from there versus just like dwelling in it.
Yeah.
But yeah, and so by bringing the attention there, your brain, I don't know how many people know this, but like your brain actually is continually building connections. And so what you focus on or what you work on is actually like your brain will grow in that area. And
Yeah,
different
yeah.
parts of your brain are connected to different parts of your body. So like if you're focused on your pelvis a lot, your brain will actually grow the area that's connected to your pelvis, which will actually grow the pleasure areas and it will actually like make a female
This
orgasm more
is like
likely. Like
this is the best segue to the next topic, which is difficulty achieving
Mhm.
orgasm. Um, so myself, um I have grown to have, and this is something that I've really been working on. This is part of like this journey that I'm on, is kind of healing this very cynical perspective of sex. It's always because starting and when I first started having sex, it was difficult for me to achieve orgasm and
Mhm.
it seemed like something was wrong with me. So I got into this mindset that like sex wasn't necessarily for me. It was always just to please the other person, and sex started and finished when he was ready and
Yeah.
done, you know? And so had I known that there were services available to potentially help me in that department, I don't know that I would have sought out those services because I still would have felt like a black sheep.
Yeah.
It wasn't really until probably the last 5 years that I'm like, look, the more people talk about the fact that it like not having an orgasm like is not the end of the world, and it's like plenty of women like have this challenge. It really wasn't until I was like, "Oh shit, plenty of women have this challenge, like, it's not just me." So, like, tell me, what are some things, like, that medically,
Mhm.
like, either whether it's, like, a cause of that or, what would be, like, the course of action to if that was, like, a desire of someone, like, what would that look like?
Um, yeah, I feel like there's so much to unpack in here. So my biggest thing was like, luckily for me, when I started having sex, like it was enjoyable for me. So that was like something good. But there's been periods where it hasn't. And it's that figuring out like, okay, what do I enjoy? What brings me pleasure? And it comes back to that intimacy part of it. Like if you aren't having that, and intimacy looks different for every person. So I think sometimes we think of intimacy as like, oh, you need to be really deep with the person and
Yeah,
like,
yeah.
stare into each other's eyes. Like that may not be it for you. And
Yeah.
some people like have mind-blowing sex and it's with a stranger, like
Yeah,
other people are like, oh my goodness, like I could never achieve that with a stranger.
right.
So everybody's different. And that's a big thing is knowing yourself and knowing what brings you pleasure. And that pleasure can be like, hey, I had a great day today because I had a coffee date with a friend and I read a book and I did all these things. Like when I have a good day based off that, then sex at night with my husband is a lot more enjoyable versus if I've
Yeah,
had a stressful day, nothing's
yeah,
going right. Like we could do the same thing, the same positions, the same pressure, like everything. But because of what happened the rest of the day, it's going to feel different.
yeah, yeah,
So I think we put a lot of connection specifically with the like the what or that we're all the same when like we aren't.
yeah, yeah,
So it's an expectation thing. What I kind of felt was put out there was like, oh, women can have multiple orgasms. Like men can only have one, but they do it quickly, but women can have all these things. Like that is really not the majority of women. Like I looked it
yeah,
up to verify. And so if you can, great, have your multiple orgasms at a time. But like if you can't, don't feel bad about it. Like your body's just not made that way or not made that way in this season. And so just because something's been some way up until this point in your life does not mean that's how it's going to be the rest of your life. Um, Also, let's talk about the clitoris. The clitoris is not just that little nub at the front, but it's actually a big horseshoe shape. So a lot of people are like, "Oh, well, I can't orgasm with penetration." And a lot of women can't with vaginal penetration. Some can. We talk about the G spot, and so I'm like, "Oh, it's just this magical thing." Like for
Mhm.
some women it is, for some it's not.
Yeah.
And being able to learn what works for you and then verbalize it to your partner will change that, as well as just even being able to say it and not have a stigma or shame around it.
Yeah.
And I don't talk to my parents about it. I don't like scream it from the streets, but like I will have a one-on-one conversation, with people about it. Um, Really can help with that. And it doesn't, like if you feel comfortable with masturbation, go for it. If you don't do it. You don't have to. Like you can find other ways to know yourself and to know your body. And not only knowing what feels good from a physical touch standpoint, but what brings you pleasure and what brings you joy, because that will spill over. Um, your body will be more, I don't even want to say the term relaxed, but just like we talked about before, like you won't be walking like this,
Yeah, yeah,
your
yeah.
pelvis is like this all the time, but it's
Yeah.
functioning better.
Right.
Um, as well as like vaginal dryness can be a big issue for women. And you can actually have, I'm trying to think of it's called atrophy, but the like thinning or like wearing away
Mhm.
of your skin and stuff. And that can cause some issues if you are having hormone issues, whether that is from your diet, from lifestyle, or if it's just because of the way your body is, you're having hormone issues. That can contribute to issues with sex because of lubrication. The amount of estrogen that's in our body, different times of the month are going to feel different too,
Yeah,
and
yeah,
we're
that's
not
true.
taught about our menstrual cycles. Like
Yeah.
even me having gone through the education, I still don't know my cycle as well as I should. um,
Yeah.
but like I was talking before I got distracted, the horseshoe shape of the clitoris and stuff. So like if you can only orgasm via clitoral stimulation, know that it's not just that tip, but experiment with the rubbing of the rest of it. And, open up an incognito browser and Google horseshoe clitoris and figure out where it goes, because
Yeah.
that's something that even in the medical community has not been known very long.
Yeah,
Like,
I mean, I didn't know that until very recently, like, a couple months ago.
mhm,
I think it was on, like, Instagram or something, and I'm
yeah.
like, "That's cool. Let me go to Doctor Google real quick." Yeah, yeah, that's wild, and it's whenever like you were saying, like, when you think about this more, you start to see more. Like, the more you think
Mhm.
about it, you see it more,
Yeah.
and so, like, even so when I saw that it was like this horseshoe shape,
Yeah.
when I did have an orgasm, I would be able it's almost like I could feel it.
Mm,
Like I could
mhm.
feel it like deeper, I guess, like because
Yeah.
I knew it was there. I don't know. It's like it really goes back to like how many mental blocks we put on
Mhm.
ourselves just in general. And I know this is specifically we're talking about women's health, but it really is just like generally we we tend to think about the things that aren't serving us instead of
Yeah.
the things that are or can serve us. And you're right, the brain is so malleable,
Mhm.
however you say it. Like it's just constantly like learning to adapt and it's finding patterns. It's trying to be efficient in whatever it is that it's
Mhm.
doing so that it can save energy. And that really is like one of the big things is thinking more about the things that you're seeking instead of
Mhm.
the things that aren't serving you. And sexual health is no different,
Yeah.
like especially now that I know, like the more I think about my pelvic floor, like the stronger it will naturally become because I'm literally sitting, not that I know you said Kegels don't solve everything, but I'm literally going, oh, pelvic floor. you
Now,
know?
when you do it, and you don't have to answer, this is gonna be personal, do you feel it in the front or do you feel it in the back?
Okay, hold on. Maybe I feel my butthole like squeezing a little bit. Is
Okay,
that bad?
so The muscles of the pelvic floor, you'll have to look this up, but they're kind of like a sling that go around our 3 openings.
Okay.
And I will also say, as a woman, a lot of women don't know this, you have 3 openings.
Yeah, yeah, that is crazy. A lot of people don't know
So
that because we don't talk
yeah.
about our private parts.
And so the muscles are kind of a sling that go around it. And so a lot of times people only feel it in the back or they only feel it in the front. Um,
So you should
and
feel
so
it.
instead, I kind of talk about it as a zipper. So think about like from your tailbone, because it connects to your tailbone,
Okay.
zipping all the way up to your belly button. Does
Okay.
it feel different?
It does. It does feel different.
Yeah. So that is a big
Like,
thing as
so it's
well.
not just one. Okay, so when you
No,
say it
it's
that
not just one
way,
muscle.
it's not just one, like, it's really like a,
It depends what
is
you're
that how
doing.
so,
And
like, should you feel it so when you're saying, like, tailbone to belly button,
mhm.
is it all at one time, or does it go, like, because I feel like if I'm squeezing, like, I feel it in my butthole. I mean, not in my butthole, but, like,
Yeah,
at
yeah.
my tailbone, and then I'm like, "Wait, hold on, I don't feel it as much in my like, in the front," so then I'll, like,
Mhm.
increase tightness there,
Mm,
but, like,
mhm.
is will over time it become, like, one fluid, like,
Yes.
step? Okay.
Yeah.
Okay.
It'll become a lot more natural as well as like I worked with a gal who was a bodybuilder and was kind of out of my wheelhouse because I'm not a bodybuilder, but like working with her for support because our pelvic floor muscles, there's a bunch of different ones that are down there. You know, we think, oh, it's just like one big ball or something. Like, no, it's a bunch of different muscles. They all have different functions. Some of them are for our hips. Some of them are, our sphincters that close to make sure that we don't poop our pants.
Yeah.
Like some are for the support because it's holding all of our organs and all of our insides, but we
Yeah.
don't think about it. We just expect it to work,
Yeah, yeah,
you
that's
know?
yeah, that is like a little light
Yeah.
bulb going off. Like, wow, yeah, because you're right. Like, we really do. We just expect it to work and function.
Hmm.
And, that's just with anything. Like, that's just not how it
Yeah.
works.
Well, and you can't see it. That's the trick. Like,
Yeah.
I can
Out of
see if
sight,
I
out of
pick
mind.
something
Yeah,
up,
yeah,
but yeah.
for
So we'll
sure.
talk about like, imagine that you're like pulling a tissue out of a tissue box with
Mhm.
your vagina or like picking up a marble. Like, there's so many
Yeah,
different
yeah, yeah.
imagery things, but that's the best thing about seeing a women's health PT is that they will work with you to figure out what cue works for you because what works for one person is not going to work for another.
Right.
Um,
And it
and
just
it's
opens the floor
personalized.
to be able to have these candid conversations to go, well, you're saying doing it like this, but this is what
Mhm.
I'm experiencing. And then you can help me problem solve and go, oh, well, think of it this way instead, or try it
Yeah.
this way. And it's like in the moment you get that recognition and like
Mm.
ability to problem solve so that
Mhm.
because so long we just get into the habit of doing something incorrectly that we just assume that we're doing it correctly,
Yeah.
and because nobody said anything, right? But like
Yeah.
when it comes to our bodies, we do the same exact thing. We just learn to compensate. It's the same reason why I'm sitting like this, right?
Yeah.
Like I know I should be sitting up this way, but it's just the more, and I know the more I think about it, the more I'll go, oh, let me fix my posture. Oh, let me fix my posture. But it's really like having that voice in your head, and I've talked a
Mhm.
lot about that too recently, is just like giving that voice inside your head a voice, like an actual voice, so that you
Yeah.
can actually hear it and go, oh no, like it just makes you more aware of those things. And that's what I like about the fact that like women's health physical therapists exist, because it gives a sounding board in the
Mhm.
moment to be able to talk through these things and like find solutions to our problems that we may not even realize are
Yeah.
problems. So yeah, so that's awesome. Well, this was so wonderful. And look, I'm so excited that you're coming on the beach trip in May. And I'm feeling like we're gonna need to have like a chat like in person. And maybe that's when we'll talk about kegels and we'll
Yeah.
do like a something. I don't know, a something. But oh man, thank you so much. And I'm sorry that we had some technology issues. I mean, I sort of expected it, but I was
Yeah.
getting hopeful. So
Well, I was hoping I could make it down, but by the time
I
like I
know.
went inside and when I went to go outside an hour and a half later, I'm like, oh, there's 2 inches of snow on the
It
ground.
has
That's
not
not gonna
stopped
happen.
since I woke up this morning, and Comet went to get coffee this morning, and she was like, my car was like sliding around, and luckily, I
Yeah.
mean, it's only like a couple blocks that way. And she said the fact that they haven't plowed the roads yet leads me to believe that they're expecting more snow.
Yeah.
So I was just like, man, I would feel so bad if something happened, or that if you felt unsafe or anything. So I'm glad we were still able to do it. And we'll do lunch and before I leave for sure.
Sounds good.
All right, girl. Well, thank you so much. I appreciate you.
Yeah. Have a good day.
All right, you too. Bye.
Bye.